We are going to be watching the removal of a completely normal growth on the cheek called a cyst. We start with the numbing medicine, which is injected with a small needle all around the spot. Next, we will make some small incisions over the top of the cyst. This is a small piece of skin that is also removed when the cyst comes out. You have to be very careful here so as to not poke the cyst. Next, the cyst needs to be very slowly dissected out of the skin and the fat underneath it. Here you can see that I am being very careful not to poke the cyst so that the contents come out, and very, very slowly dissect it out from the underlying surrounding tissue. I'll just be quiet here so you can enjoy this very satisfying portion of the entire procedure. The medication that we use to numb the area has some epinephrine in it, and it helps minimize the bleeding during our procedure. You can see here that there is very small amounts of blood during the entire procedure. The cyst is almost out, just freeing it up from these last couple small areas of fat that it's stuck in. You can see it is actually much larger than we thought it would be. Now we just work on stopping the bleeding from some tiny little vessels. Now we start working on putting the stitches in. First, the deep stitches are placed with a completely dissolving suture material. The purpose of placing these deep stitches is to help the fat and skin come together nicely. This will hopefully help the scar lay flat rather than having a small divot in this area. Once the deep stitches are placed, the wound should come together very nicely and look like it is completely together on its own. Now I'm going to be looking for any gaps that still need to be closed or any puckers that have to be removed. One corner here is laying completely flat while the other one is still just a tiny bit puckered. So here I'm going to remove that pucker. Now I'm going to place one last deep stitch to bring that entire area together. Now we start with the top stitches. These are placed to bring the skin edges together very nicely and to make sure that there is as minimal a scar there as possible. When we cut the thread here, we leave a small tail so that we can grab one of those small ends when we remove the stitches. And there you have it, the removal of a completely benign growth called a cyst from the face.